can do so as we go. I shared this with today's class, but I don't think I shared it with yesterday's. There are 58 slides to cover. So I apologize now. I'm going to be talking a little fast because I can get all 58 slides in. I just can't dilly-dally to do it. All right, so we are recording and we are going to get started. This lecture is going to cover chapter 13, which is regarding over-the-counter products. So transition from prescription to OTC. In 1951, the Durham-Umfrey Amendment to the Food, Drug, and Cosmetic Act of 1938 created two classes of drugs. Prescription, which is any drug with the potential to be highly habit-forming or could impose harm on the patient, and non-prescription. There are 700 plus non-prescription products on the U.S. market today. So the transition from RX to OTC status, in order for this to happen, the manufacturer must file a new drug application, commonly referred to as an NDA, with the FDA. Normally after the drug has been on the market as an RX for several years, allowing efficacy and safety data to be accumulated. And then approval for the RX to OTC switch takes 10 or more months. So some key questions the FDA must be able to answer in order for this switch to go through is the product safe for consumer use based upon market research and data collected by manufacturers? You can mute yourself. What is the potential for abuse? Are drugs benefits greater than its risk? How easily would the average consumer be able to administer drug in relation to self-diagnosis and drugs intended use? So the FDA can remove non-prescription status if the drug is found to be unsafe or without benefit to the average consumer. An example would be the combination cold medications for infants and toddlers under the age of 2 that were removed from store shelves back in 2011, when the FDA decided that the risk outweighed the benefits. And there was a number of cough and cold medications that used to be available for children under 2 and infants that were removed back in 2011. So common over-the-counter products are used for a number of things. The first we're going to look at are like pain relievers, fever reduction, aids for sleep, relief from the symptoms associated with allergies, runny nose, sneezing, watery eyes, elimination issues associated with constipation or diarrhea, and reduction of cold symptoms. So the first group we're going to look at are the analgesics and antipyretics. If you remember from our drug classifications to know, analgesics reduce or eliminate mild to moderate pain. Antipyretics reduce or eliminate fever. Analgesics and antipyretics include things like acetaminophen, which is the chemical or generic name for the generic name, not the chemical name. Generic name for Tylenol, which is used for pain relief. Extended use greater than 4 grams per day can cause liver damage and even death. Watch for other products containing acetaminophen, and again, the brand name is Tylenol. So when a patient comes in with a product or a prescription for something like Norco, your pharmacist should be having a conversation, or the doctor should have had a conversation with the patient that they do not want to take any Tylenol products, or if they do, to watch how much they're taking and when they take them around that Norco, because Norco is hydrocodone with APAP, and APAP is the abbreviation for acetaminophen. So if the patient's to double too much of that, they could put their liver at risk. Aspirin is the next item we'll look at. It's salicylate, and I may be enunciating that slightly wrong. I apologize. This is used for pain relief, reduction of inflammation and swelling, and for fever. Children under 19 with fever associated with chickenpox or flu are at a greater risk with aspirin for contracting Reye's syndrome. Daily low aspirin dose in adults has an antiplatelet properties, It's going to reduce the risk of heart attack or stroke. Non-steroidal anti-inflammatory drugs, commonly referred to as NSAIDs, such as ibuprofen, naproxen, and magnesium salicylate, reduce inflammation and fever. Similar warnings as aspirin, potential for gastrointestinal side effects, dosing adjustment for those with renal impairment. FDA black box warning for increased risk of stroke, myocardial, that's supposed to be infarction, cardiovascular thrombic events for patients already at risk of cardiovascular disease. So you'll notice a lot of times your cardiovascular patients will shy away from these NSAIDs because of these risks. Antihistamines are considered a respiratory system agent. They help block histamine and leukotriene receptors, alleviating symptoms like sneezing, runny nose, and watery eyes, or other allergic reactions, hives, itchy, irritated eyes, and skin. Some cause drowsiness, may not be safe for people with glaucoma or high blood pressure. Some are not appropriate for children and need to be aware of drug interactions. Antitussives are going to suppress unproductive coughs. They're often used with an expectorant or a decongestant. Consumer groups and FDA question use in children under 6. And dextromethorphan is the only over-the-counter antitussive marketed in the United States. Decongestants provide relief for stuffy nose or narrowing swollen nasal passages and allowing sinus drainage and mucosal buildup to be freely expelled from the nose. Pseudoephedrine and phenylephrine both interact with monoamine oxidase inhibitors, commonly known as the MAOIs, and tricyclic antidepressants, and herbals, ephedra and yohimbine. Nasal sprays are safe to use, but in 3 to 5 day increments, so as not to cause rebound congestion. There are some rare cases where, under the guidance of a physician, a patient may be utilizing a nasal spray from over the counter for more than 3 to 5 days, but the key there is that they are under the supervision of a physician. The FDA recommends against nasal spray for children under the age of 12. And questions regarding decongestant should be referred to the pharmacist or patient's physician. Excuse me. Expectorants. These help loosen and thin mucus and phlegm buildup in the lung due to nasal or other mucosal drainage, turning unproductive cough into a productive cough. Guaifenesin is a prime example. It is indicated for chest congestion and cough due to colds or flu. It, however, is not going to be very effective on coughs, chronic coughs from COPD, asthma, smoker's cough, or emphysema. Next, we'll look at the gastrointestinal system agents. Chief of these is going to be the acid relief medications, or antacids. Antacids neutralize stomach acid. H2 receptor antagonists block stomach acid and help to prevent GERD. Proton pump inhibitors reduce stomach acid and aid in the healing of peptic ulcers. Questions on any of these over-the-counter products should be, once again, referred to the pharmacist. And why? Because it is never okay for a pharmacy technician to answer questions regarding medications or counsel a patient. Antidiarrheals are not recommended for children under the age of 5. They may increase risk for dehydration in older people. They should not be taken for more than 3 days without consulting a physician. Examples of over-the-counter antidiarrheals would be loperamide, bismuth subsalicylate, which is generic for Pepto, and digestive enzymes such as probiotics. Loperamide is Imodium, by the way. Antiemetics. These are used to subside or reduce the incidence of nausea and vomiting. They're not recommended for children under the age of 6. Patients should see physician if symptoms last longer than 24 to 48 hours or worsen after 24 hours. And these can help prevent dehydration. Anti-flatulents are going to rid the stomach and intestinal tract of excess gas and air. Simethicone and activated charcoal give relief once gas is already formed. Alpha galactosidase and lactase replacements help stop gas formation. Probiotics and over-the-counters are food like yogurt. Antihemorrhoidals are going to provide relief and reduction of burning, itching, and swelling caused by hemorrhoids. Do not use if non-hemorrhoidal anorectal disorders such as polyps, fissures, inflammatory bowel disease, or abscesses are present. If bleeding is associated with hemorrhoids, do not self-medicate. Consult a physician. Laxatives treat constipation. They're categorized by mechanism of action: bulk forming, emollient, softening, lubricant, saline, hyperosmotic, stimulant, or combination. Chronic constipation may indicate a more serious problem for which physicians should be consulted. By the way, just back to that with the constipation, you will see a lot of constipation medications and laxatives and things in the pharmacy simply because a lot of patients are dealing with pain management. And with pain management, a lot of those patients are put on opioids, a Bointype or another. Opioids have a tendency to cause constipation. So next we'll look at the integumentary system agents. The integumentary system is the largest system in the human body. It includes the skin, hair, fingernail, and toenails rather. So the first thing we're going to look at is acne. This is a dermatological condition typically affecting teenagers. Over-the-counter products include benzoyl peroxide, salicylic acid, sulfur, alpha hydroxyl acid, or a combination of several of these ingredients. If acne is chronic or not helped by over-the-counter treatments, see a physician. Alopecia is the loss of hair, and it can occur in men or women. Androgenetic alopecia is inherited. In women, it is called female diffuse hair loss. Areata alopecia is loss of hair follicles. No product will completely restore hair, but they do help produce growth. Minoxidil is the only over-the-counter alopecia ingredient available as generic and as brand name. Brand name for minoxidil, by the way, is Rogaine. Anti-infectives. These prevent infection and minor cuts and scrapes. They contain a combination of bacitracin, neomycin, and polymyxin B sulfate. They may have local anesthetic agent to numb the affected area. If the wound is not healing after 7 days, see a physician. Corns, calluses, and warts. Corns and calluses are abnormal growths of skin formed from repeated friction. Warts are caused by human papillomavirus and normally form on hands or feet. Salicylic acid is a key treatment ingredient. Children should be administered therapies formulated for children. If over-the-counter treatment is unsuccessful, see a physician. Dandruff or seborrhea is a form of eczema characterized by dry, itchy, flaky skin, primarily seen on the head around hair follicles. Anti-Malassezia products attack growth of yeast cells. Pyrithione zinc is the primary ingredient. Selenium sulfide works like anti-Malassezia, and I'm sure I'm saying that wrong, but must be washed thoroughly from hair to avoid discoloration. Ketoconazole is a synthetic antifungal that combats fungal infections causing eczema or dermatitis. Coal tar dandruff shampoos treat dermatitis and psoriasis, can cause discoloration and contact dermatitis if left on the skin for a long period of time. If dandruff does not respond to over-the-counter treatments, consult a dermatologist. Dermatitis or dry skin Common treatments use petroleum, mineral, and urea and camphor. Trial and error process, and it becomes a matter of personal preference on these products. Children under 2 should see a physician. Changing habits can help dry skin. Things like not wearing perfume, dry thoroughly after bathing, proper hydration, such as drinking water and such, mild soap for bathing, and don't use excessive amounts of moisturizers. Next, we have head lice. Warm, fuzzy thought that makes us all want to scratch. So these are bugs that spread by close contact. August to November is the height of lice season. They lay eggs or nits close to the scalp and reach adulthood by the 9th day. Infestation cycle can repeat every 3 weeks. Treat with pyrethrins 0.33% and piperonyl butoxide 4% and a lice comb. Sunscreen and sunburn. Sunscreen is rated by the FDA for efficacy and safety. SPF, or standardized sun protection factor, of 15 plus may be labeled as aiding in prevention of skin cancer. FDA is considering a rule that no sunscreen be rated higher than SPF 50 because they have found that there is just no clinical benefit. And SPF 30 plus, specifically rated for infants younger than 6 months, recommended for this age group. Sunburns can range from mild to very severe. Effects are not immediate, but felt fully a few hours later, as most of us have probably experienced. Staying out of the sun promotes sunburn healing. Topical products reduce pain and swelling, such as aloe vera gel and NSAIDs like ibuprofen will help with pain and inflammation. Next, we'll look at the central nervous system agents. So over-the-counter medications with direct effect on the central nervous system do exist. Examples would include diphenhydramine, which is Benadryl, and pseudoephedrine, which is generic for Sudafed. Side effects can include confusion, loss of balance, dizziness, and anxiety. Questions should be referred to the pharmacist. Ophthalmic agents. These drops are going to go directly into the eye. Ointments would be used along the eyelid. Ophthalmic antihistamines are available for symptoms associated with allergic rhinitis or seasonal allergies. It's going to help with symptoms like watering, itching, burning, and redness. Most contain phenyramine maleate or antizoline phosphate, which is an antihistamine in combination with the decongestant napzoline. So ophthalmic decongestants can be used to treat viral conjunctivitis or pink eye. There are 4 primary ingredients are nafazoline, often combined with antihistamine ophthalmics, oxymetazoline, phenylephrine, and tetrahydrozoline. Sorry, that was a mouthful. Coincidentally, there's more than one kind of pink eye, just so that you're aware. So artificial tears can treat a variety of eye ailments, such as viral conjunctivitis, allergic conjunctivitis. So there's your 2 main breakdowns on the pink eye. Dry eyes or irritations of the eye, such as redness. Often used in conjunction with an antihistamine, ophthalmic, or a decongestant ophthalmic. Lubricant like hydroxypropyl methylcellulose or carboxymethylcellulose, CMC, would be used. Otic agents. Remember, otic is for the ear. So cerumen softening products help remove excessive earwax. Carbamide peroxide is an example of a product used for the removal of earwax. There are ear drying products that are going to help dry water or fluid trapped in the ear canal. And they generally are going to contain isopropyl alcohol and anhydrous glycerin. There are botanical and homeopathic products that may ease mild ear pain. Main ingredient is typically going to be olive oil or a vitamin E oil. Oral agents. These are going to treat conditions of the mouth or oral cavity. They can be liquid, solution, paste, and dissolvable strip. Everything from toothpaste to pain relievers. Oral rehydration products like Pedialyte or Sterilite are in this category as well. Cold sores, these are caused by herpes simplex labialis. They are contagious and spread by direct contact. The only FDA-approved over-the-counter product for cold sores is Doxonil, 10%, under the brand name of Abreva. For oral pain, such as tooth pain, teething, irritations from dental equipment, sores in or on the mouth, there are topical solutions, cleaning agents, rinses, and protectants for those issues. Contraceptives. These are used to prevent pregnancy. Condoms are shown to be the most effective in conjunction with oral birth control sometimes, or maybe even an injectable birth control. They also help prevent the spread of STDs, which most of the other birth control does not. There are male and female condoms available. More effective when used with spermicidal jelly or foam. Non-latex options for those allergic to latex are available. They're not quite as effective, but they are available. Spermicidal foams, creams, and jellies. These are going to block sperm from reaching the egg, less effective birth control than condoms. And again, this is not going to protect against STDs. Contraceptive sponges. This is a barrier method that works best with spermicidal foam or jelly. And again, not as effective as condoms and not going to prevent against STDs. Smoking cessation. So we can use things like nicotine lozenges, nicotine gum, nicotine transdermal patches. These are not for patients under 18 or those with underlying heart defect or other medical conditions comprising their health. Not for women who are pregnant or breastfeeding either. Next, we'll look at behind-the-counter products. These are non-prescription products with an element of risk, but still classified as over-the-counter. They are not currently an FDA standard, but category exists in the UK and Australia. The Patriot Act of 2006 requires consumers to show ID to purchase pseudoephedrine because it can be used to compound street meth. Incidentally, because we're discussing pseudoephedrine here, a lot of you will be getting ready to head to clinicals at some point. Most of these clinical sites are not going to let you run a cash register just because of their own company policies. However, until you are an actually nationally certified registered pharmacy technician, legally, you are not permitted to sell pseudoephedrine. You need to have a pharmacist or a technician or a pharmacist intern. They don't necessarily have to have you sign out of the cash register, but they must be present as the sale occurs. Just be aware of that. Protect yourself legally. Some communities regulate distribution of insulin syringes to help stop the spread of HIV and hepatitis C. And that's going to vary from pharmacy to pharmacy on their policy with regards to the sale of insulin syringes. Some are fine with it. It's better for them to have a clean needle than to try to be using a dirty needle. And others want to see some type of prescription item. So that's something you'll have to play by ear as you get jobs. And emergency contraceptives are given 72 hours within 72 hours to prevent pregnancy, often for situations such as rape and or sexual assault or failed contraceptive usage. There's things like Plan B, and there's another alternative. The name is escaping me at the moment. Unfortunately, you will find in the pharmacy that in general, I feel like some people use Plan B as a backup birth control method, and that's not really what it's intended for. Herbal and alternative treatments. So any product made from a botanical or plant would be considered an herbal or alternative treatment. These are not regulated by the FDA, so they do not have the same monitoring standards as OTCs and RXs. They're considered dietary supplements according to the 1994 Dietary Supplement Health and Education Act. FDA law says that no herbal may claim it treats a specific ailment or disease. And now we have vitamins and supplements. 50% of all Americans take some form of vitamin or nutritional supplement. These are helpful for people with poor dietary habits, the poor, older people, and people whose health is compromised. Vitamin formulations is available for infants, children, and adults. You want to keep these out of reach of children and pets because too much of anything can be too much. Medical devices and diagnostics. These are items which aid in care or monitor care for health of patient. Not all are reimbursable through insurance or flexible spending accounts. Medical devices include walkers, canes, crutches, slings, hearing aids, glasses, urological supplies, etc. Diagnostics include blood pressure cuffs, glucometers. Cholesterol. There are now home cholesterol monitoring tests that have been on the market since 1993, but debate continues about whether they help or hinder. They don't actually distinguish between HDL and LDL, and any questions regarding these or the results should be directed to the pharmacist. Now we're going to look at diabetes. We have type 1. They've labeled here as juvenile diabetes. This is those individuals whose bodies do not produce any insulin at all on its own. Type 2 is more commonly referred to as insulin resistance, or their body is producing some insulin, but not enough to compensate. And so they tend to control their situation by diet or insulin. Type 1, by the way, is controlled by insulin. You can do with the diet all you want, but because the body's not producing any insulin on its own, they have to inject insulin. And then gestational diabetes can occur during pregnancy. This is controlled by diet and or insulin. The diabetics are going to need to use a blood glucose monitor. This reads blood sugar using a finger stick test. Also need strips, batteries, lancets, alcohol wipes. These days, they may even be using a transdermal system. There's a couple of brands now that have a transdermal continuous monitoring system, but those also are going to require some supplies as well. Other insulin supplies, the patient will also need syringes, sharps container, and a carrying case. Urinary ketone strips are going to test for rising sugar levels in the urine. Fertility and pregnancy tests. So fertility tests indicate if a woman is ovulating. Pregnancy tests indicate if a woman has conceived. They're relatively easy to use and surprisingly accurate. False positives and negatives can occur, so results should be checked with their physician. Nebulizers are machines that vaporize medication into the air in order to open up airways. Used for people with asthma, especially children. Most pharmacies would need to special order a nebulizer. Pharmacy technicians should remember to ask questions such as the size of the patient, need, portability, physician's preference, and insurance coverage. You'll find a lot of retail pharmacies in general these days have actually started keeping nebulizers on hand. They're just getting to where they're used that often. Test screening kits. Tests only indicate a marker for a problem that may need a medical attention. They are never 100% accurate. In addition to tests for ovulation, pregnancy, and cholesterol previously discussed, over-the-counter tests are available for commonly used illicit drugs, and they are considered up to 99% accurate. OTC tests are available for sexually transmitted infections, such as a bacterial infection involving chlamydia, syphilis, gonorrhea, and trichomoniasis. Viral infections such as herpes, hepatitis B, HIV, which is the human immunodeficiency virus, and HPV, human papillomavirus. Some STI tests provide privacy. Home STI tests provide privacy, but the physician should still be consulted, especially if a disease is indicated. Medical supplies can mean anything that aids a person with medical needs or condition, such as devices covered previously. Insurance companies each have their own rules about which supplies they will pay for. Medicare does not pay for supplies that do not meet its definition of durable medical supplies. And you will find in a retail pharmacy setting that the supplies are very difficult to get covered on their insurance. A lot of times the insurance company is going to require that the patient utilize a medical equipment supplier. So the pharmacy technician's role with over-the-counter products, devices, and supplies. The pharmacy technician must be familiar with products, with over-the-counter products, and their uses to assist patients with their needs. Understand their legal limitations and refer consultations to pharmacists. Understand billing and ordering issues for over-the-counter products, devices, and supplies. Stay current on new products and changes. So in summary, over-the-counter pharmacy is an involved specialty area. Pharmacy technicians must understand over-the-counter products, billing and ordering, own legal limitations. Over-the-counter products and devices changing constantly, so there's always new information to learn. And that was it for our slideshow. And so you can, I don't know if any of y'all can see the time that I can see. So we have like less than 5 minutes to go because that was so many slides that we had to cover. There is a quiz on chapter 13 for y'all scheduled for Friday. It will be given through Edmodo because of the way it fell into the curriculum. So I will be posting because there is not time to also do a review, and we do not have another Zoom scheduled between now and then. So I have a pre-recorded chapter 13 review that I will post along with this recording of the chapter 13 lecture. I will post both of the lecture and the review recording as just a post. I'm not going to attach it to the Zoom meeting because I want to make sure that everybody can access this at their leisure as they need to. I know some of you will probably be doing your studying during the day and waiting till probably the last minute tomorrow to take the test, and that is perfectly fine. But I want you to be able to still access the lecture and the review once the Zoom assignment locks out. So that is the why I will post it as a post. Does anybody have any questions about the material that was covered today? Was anything unclear? I feel like this chapter is pretty straightforward. There's just a whole lot to it. All right, well, if y'all don't have any questions for me, I'll let you get back to your day. And just as soon as I get this meeting buffered out, I will get it posted up for you. So I hope everyone has a great day. And do not forget that our lab times change officially next week. We will start the new lab schedule. If you have lost track of what it is, fear not, I'll be posting another reminder onto Edmodo tomorrow. So again, I hope you all have a great day. Our Zoom meetings are also changing with those lab time changes. I'm sorry, I keep thinking of other things. So Zooms are moving to Mondays and Wednesdays at 9:30 in the morning. And I'll post that with the lab time reminder tomorrow as well. All right, if you think of a question or something comes up after the fact, as always, shoot me a message. We'll work through it and get it worked out. Hope you all have a great day, and until we see each other again, bye-bye for now.